How often should patients with chronic constipation see their doctor, and do they need regular tests?
I think in the initial period, they will have to see the physician more often, uh, particularly for performing tests and to initiate a treatment and to see if the treatment is effective or they have to make some treatment changes. So the first few visits may be once every few weeks for a few months until they have a stabilized plan of treatment. Once patients have reached a stable level of treatment, then every 3 to 6 months or sometimes even a year follow up would be worthwhile. Usually, once the diagnosis has been made, there is rarely a need for further testing. I mean, if we know that the colon is lazy, then there's no need for testing. But in certain situations, there may be a need. For example, the patient is on treatment, they are either not responding to treatment or they've responded previously and now they've stopped responding to treatment. So we really want to learn what has changed in their bowel. So if they had a slow transit before, now you've given them treatment and you want to know, well, is this treatment effective or not? So you can repeat the colon transit study on treatment to see, is it working or not working? If it is not working, we know then that that treatment is not working, hence the patient has symptoms. Or also to know sometimes maybe, am I on the right track? So that is another reason to repeat symptoms. For example, if patients with dyssynergia, we do biofeedback treatment. At the end of biofeedback treatment, we repeat in rectal manometry to see if some of the abnormalities they had, have they all been corrected. And that reassures us, in addition to the symptoms, that they've actually improved. So that's what we